Good morning, everybody. I'm Dr. Craig Bax. I'm the Chief Medical Officer and founder of the Cure Center for Chronic Disease in Springfield, Illinois. The goal of the Cure Center for Chronic Disease is the reversal and ultimately remission and cure of arterial disease, type 2 diabetes, prediabetes, insulin resistance. Those are the conditions that comprise cardiometabolic disease and lead to stroke, heart attack, kidney failure, dementia, and early death and disability, and life-changing procedures like stents and bypass surgery. And I'm happy to report that in the last 10 years, over 1,000 patients, that none of our patients have suffered a stroke or a heart attack. So those are results that I think are hard to match, particularly with a mainstream approach. And I have with me today Dr. Keith Buescher. Keith is a clinical psychologist who we worked in the same building, and one day I encountered Keith in the parking lot and was telling him about our screening process using carotid ultrasound. And I'm happy to have him with us today and able to and willing to talk a little bit about his experience with the processes that we employ at the Cure Center, and maybe even a little bit about his results if he's willing to share. So welcome, Keith. Thank you for joining me this morning.
Well, thanks for the invitation, Dr. Bax, and I appreciate being given the opportunity to tell you a little bit about my story. Sure.
So as you can tell, Keith is not the picture of being unhealthy. He's an avid cyclist, athlete, keeps himself in great shape, exercises pretty much every day, eats pretty clean. And although we may have changed his definition of that a bit in the process of our care, but I guess I'll start out with your reaction when I suggested that maybe you could be a victim of arterial disease and not know it, and offering the opportunity to find out more.
Well, yes. I guess initially I was a little surprised, particularly after my first visit, where I had my arteries, carotid arteries, ultrasounded. Not very good news as far as, and you can speak more, of course, knowledgeable about this regarding my risk factors. I know genetically I had a risk factor with both parents having some form of vascular disease. But I thought I was doing everything I could, and I was still, it sounded like, not in good shape in a vascular sense, right?
Yeah, and it's a humbling experience. I know when I had my first ultrasound, I wasn't surprised. I mean, I knew my lifestyle wasn't all that it should be. I was taking a statin. I had the family history, but the fact that it kind of hits you straight in the you see it, and seeing is believing. And now what are you going to do about it? And that set me on a course of researching just for myself initially, and then realizing that, holy cow, there's a lot more that we could and should be doing to address this problem, rather than just putting a Band-Aid on it, watching it get worse, and then ultimately treat it with a stent or surgery if the person gets to the hospital in time for a rescue in the case of an event. So that's what set me on the course of this proactive practice of early detection and early lifestyle supplement and medical intervention. And so it's it's a lot of fun bringing this to people, sometimes surprising them. I don't like to give people bad news or bad surprises, but I think it's also unkind to not make them aware of threats that are sitting there and just waiting to strike or attack when you least expect it, and when it's least convenient and very disruptive to life if it doesn't end. So you had the screening ultrasound. We found a little bit of arterial disease, and what I tend to tell people, that's like having a little bit of an infection or maybe a little bit of cancer, and you wouldn't sit by idly waiting for it to get worse before deciding to intervene. That's your best opportunity for disease remission and a cure. So we found it, and then we measured it, and then we set about finding out what was causing it. And one of the key things with our program is, I think the key to success is coachability. Are we willing to open our minds to admit that maybe there are things that we don't know that we don't know, and that some of the things that we know just aren't so, and that's fueled by the mainstream conventional wisdom, if you will, that is kind of baked into the protocols that most physicians, including cardiologists, are kind of held to. So anyway, I shouldn't be talking so much. I should be asking Keith more to share more of his experience. So once we set on that path, what are you doing differently now that what do you know now that you didn't know? What did you learn that what you knew wasn't so? So go for it.
Well, no, I think you're hitting the nail on the head there. It's like, first of all, this is a very collaborative experience, which I so appreciate. And, it is eye-opening when you think you're healthy, and I pretty much am, but I could be much healthier and certainly reduce my risk. So yeah, the collaborative work of saying, okay, let's work on this together is about what we can modify, as you're pointing out, both with maybe traditional medical interventions, and more importantly for me, where it's in my control, is like how I manage my stress, what I eat, and even how I exercise, and more lately, even when I eat. I think we've refined that even further. I'm sure you could, extrapolate on that. But overall, the experience has been empowering and also, enlightening. So I feel like I'm kind of getting, medical advice as well as coaching, and as well as a collaborative teamwork experience, and I think it makes all the difference in the world, because it's an adjustment at first, saying, oh, I do have these risk factors, and I can't really avoid. I guess I could avoid, but then all those bad things you said as we started this discussion could increase, in probability to have happen. So, in all, it's been a good experience, particularly I think seeing in real time, the ultrasounds I think and the videos of those, and showing me, where I have some problems and all, and explaining it to me, I think makes all the difference in the world. It's not like I'm just showing up and you say, take these pills and we're
done. So recently we've had, I'm just looking at it now, trying to remember, we started in February of 2021.
Mm-hmm.
And your arterial age at that time was, if you don't mind my saying, it's 25 years older than your chronological age, which I think was
almost 100. Thank you very much. That was scary, right?
Was quite shocking to both of us. But more recently, the news has been a little bit better. I'm looking at your numbers, and you've gone from an arterial age of 85 down to 71. It's been as low as 63. So, just generally speaking, the results have been gratifying, at least to me, and I believe to you as well. So,
very much
interested in your comments about further comments about that, and what are we doing differently now than what was being done previously?
Well, it's very motivating to actually see this improvement. I guess, again, you can speak more learnedly about this, but reversing maybe something I didn't know if it was reversible or curable. That's given me a lot of hope, and just confidence for the future. What I have done was, of course, you've augmented, basically my treatment with, some prescribed medications, some supplements. We've done some dietary changes, both with what I eat and when I eat. I do some stress management. I could probably do a little bit more of that. So it just seems like a better holistic approach, as opposed to go in, be a passive participant, and really not be engaged in the process. So that's made a world of difference for me. And frankly, I think I even feel healthier subjectively over the last couple of years.
I think one of the things I encounter frequently, particularly with athletes who have been taught for decades to perform optimally, that you need a lot of carbohydrates for energy, that you need to carbohydrate load. And what's been interesting to me is I see a lot of these folks, unbeknownst, or they're thin, they look fit, but inside they tend to have, I don't remember specifically in your case, but we use body composition analysis to point out that, hey, you're skinny on the outside, but a little bit fat on the inside, and there's a lot of insulin resistance in the particularly the running and the long distance performance athletes who are eating in that way. So I think I'll just summarize. I think the main change is I try to deprogram a bit in terms of on a daily basis, maybe limiting carbohydrates, maybe adding them back when getting ready for a race, but that on the general sense that your body is running more on a ketotic basis. And then you said what you eat and when you eat, and so maybe talk about how time restricted feeding, or I call it window feeding or intermittent fasting, has factored into your program.
Oh, certainly. I think that's been the most recent thing we've done since I've seen you. The last time I saw you was a couple of months ago, and the window feeding. I'm feeding for about 6 to 8 hours a day, and the rest I'm not. That's a big change for me. Previously, I used to eat a big breakfast, eat a medium-sized lunch, maybe a smaller dinner, but that was over a period of 12 to 14 hours, and it took a little adjustment, I think. Just we're habit formed, and it took a little adjustment the first few weeks, but now I'm pretty good at stopping eating about 7 in the evening, and I don't eat again till about noon the next day. Drink a little unsweetened tea just to get me going in the morning, but that's it. And I honestly I've noticed no difference in my performance in some of my races and things like that, and even just my energy throughout the day. It seems more stable, and I assume by extension I'm having less maybe risk of inflammation because my sugar load is much less throughout the day, and is in a much narrower window than it was. Again, you can speak more learnedly about that, but I feel like that's healthier for me, and I'm not missing it that much. Sugar withdrawal, though, is a thing, and I think I'm moving past that. It takes a while.
Yeah, I think it's very clear that sugar, and starch by extension, because it breaks down into sugar, is in fact an addictive drug, and it's a part of our culture. It's inculcated into almost everything that's in processed foods, and it not only affects our cravings for sweets, but also, I think you can say more about this, but to behavior. I mean, I know that since I've been promoting my patients to eat less starches and carbohydrates and sugar, that seems I see I'm prescribing less antidepressant medication, and the mood and anxiety seems to be affected, and it is a stimulant. It does affect the brain centers that are affected by other addictive drugs, the dopamine reward system, and there is a withdrawal from it. In fact, I think some of what people can refer to as the keto flu is actually sugar withdrawal, I think, in many cases. So it's not a pleasant short-term experience, but in the long term, the benefits are pretty hard to deny.
That's been one of the biggest adjustments for me, is just dietary, what and when I eat, and but I think with your guidance, it hasn't been that difficult. It just takes some mindful approaches and some awareness to stay on it on a daily basis. That's sometimes a challenge depending on what my day is like.
Yeah, and I think we need to acknowledge that it does affect, since meals are often a family and a social interaction in addition to a nutritional event. If your family's not on board, that can be difficult. So that's one of the reasons I really like working with particularly couples, so that they are, mutually supportive, that, we tend to mirror the behavior that we see. And so, we can either support each other, or it can undermine each other. And it's not necessarily malicious. It just is, can happen. So, I mean, for most of my patients, the easiest thing is for them to delay breakfast and not eat cake and candy for breakfast, which is what Dr. Kellogg told us about the most important meal of the day is that eat breakfast cereal, which is essentially cake and candy. And that's just, so, it's like the system is designed to create the disease, and then then we sell the drugs to treat the disease. And so finally, and I don't want to take too much more time with this, but I've been spending the last 10 years refining. The science has been pretty much the same. The treatment hasn't differed all that much from what I was doing 10 years ago. The way I go about delivering it has changed. I've developed tools that have made it more digital, more user friendly for media like this, telemedicine, using video conferencing, and make the whole process hopefully more consumable. So I hope you don't mind maybe sharing some of your impressions about not only your results, but also the process, and how difficult, or hopefully not too difficult, it is to learn about the principles and be supportive in the changes that you made.
Yeah, if I could just maybe add a few things. I think, the process has been intriguing to me. I'm naturally a curious person. Maybe that's why I do what I do for a living. Yeah. But I think you have nurtured that and engaged me in being curious as to how I could further refine some things and not make it feel so like daunting and overwhelming. I think we've kind of taken this piecemeal over the last, maybe not the best word. It's been sequential over the last 2 years, and we kind of build upon where we've been successful and continue. So really the coaching aspect, I think, is critical for engaging. But I think your patients also need to be curious and open-minded to making some modifications. And it's really not all that hard. Once you make these behavioral changes, you probably have to make the decision in your head first and then implement behaviorally. And I think it's very doable. And again, it's sequential, it's incremental, and it's not all that overwhelming if you just take it a bit at a time.
Yeah, I think if I can contrast with the way I've approached this compared to a lot of other programs, is that, if you're heading in this direction and we need to be moving toward in this direction, we don't just flip and automatically go 180 degrees. We do what we can, and incrementally, stepwise, achieve that movement toward an ideal. And I constantly say to patients, look, we're not looking for perfection. We're just going to support progress and, keep moving in the right direction. As much as, an athlete trains, or, anybody learns a new skill, if you try to learn all the skills at one time, chances of failure are pretty high. But it really starts with motivation. I do take a significant amount of effort to understand what would motivate somebody. Are they, because I think maybe you can speak to this as a professional in psychology. If you don't know why somebody would do something, it's very difficult to overcome that. Right. You probably use this yourself. How many doctors or psychologists does it take to change a light bulb? Only one. But first, the light bulb has to be willing to change, and so we work to kind of ferret out, okay, what would make this person really want to make these sometimes difficult changes, and sacrifice, which is by definition is giving up something good to get something better. And so I hope that our program is, I think you pretty well described it that way, that we try to give it in consumable bites as opposed to eating the elephant all at one time. I try to reassure people, for instance, that, I run into people all the time. Well, if just everybody would eat a plant-based whole food diet, these problems would go away. And there may be some parts of our society where that's possible, or likely, but for the most part, in the culture that we live, it's not supported. And so what can we do to move closer to that from where we are? As just one example. Or the willingness to take certain medications, like for instance, statins, have a bad reputation, but because largely I think we're inundated with adverse information, and I think maybe you were one of those that might have been a little bit skeptical. But when we when we pointed out that, you don't have to take 80 milligrams of the most powerful statin. You can take it every other day at a much, much lower doses and still get very good results. So as one example. So,
right.
Well, I think,
I appreciate that approach.
Yeah. Well, any further thoughts before we wrap up? What would you say to anybody who's watching this video and is maybe skeptical about embarking on this process? What would you say?
I would say, well, not blindly trust the process, but understand that this joining with your healthcare professional and working together on all these different domains, behavioral, physiological, emotional, mental, thought-wise, etc. I think really does make sense, because when you're changing something, you got to look at all those aspects. And I do, to loop back just a moment, I do think the initial questionnaire that I filled out, has all these different categories of potential change or potential problems that you should change or would be best to look into changing. That was very helpful as a start. And I've never felt judged by this process. It's more like it was a collaborative joining effort that I don't think we oftentimes, well, we sometimes get in traditional Western medicine, but I think it was more pronounced here. That it was like, okay, I'm working with you. I'm not going to necessarily tell you what to do. I'm going to make some suggestions, and let's take it a bit at a time. Like you said, don't eat the whole elephant at one time, and a little bit in it. And that was very beneficial.
Yeah, it's a lot of it. It's like a negotiation. In fact, it is a negotiation. And my favorite definition of negotiating with somebody is letting the other side have your way.
Right.
Because once it becomes, as long as it's my idea, it's not yours, you're probably not going to buy into it. But once it becomes your idea, particularly if I allow you to let it become your idea on your own, then it's going to stick. So, well, anyway, thanks so much, Keith, for participating in this dialogue. I believe it's going to help a lot of people understand this process, which is rather different, and that's a real challenge when you're offering something that's very counter-cultural, particularly with something as ingrained in our society as healthcare, as important as it is. And I'm not here to put down traditional healthcare. I have one foot firmly in allopathic medicine, but I do tend to refer to myself as a recovering allopath or an open-minded allopath. And so I think we're all learning, and I'm committed to continuing to learn, incorporate new thoughts and ideas, get rid of old things that aren't working so well. And that's maybe that sums up the process that we all need to be on if we're going to continue to grow and be healthy and have optimal lives. So not dying a little bit at a time, but living old and then die old and healthy.
Right. No, I thank you very much. Very much appreciated and gratitude. Thanks.
Okay. All right. Thanks. Have a great one.
All right. Take care.